Hello, I'm Kulwinder Dua from the Medical College of Wisconsin, Milwaukee, USA. Today I will briefly be commenting on our manuscript that recently got published in the journal Gastrointestinal Endoscopy. In this study, we looked at the efficacy of lumen-apposing metal stents without and simultaneously with double-pigtail plastic stents in treating pancreatic pseudocysts. Traditionally, pancreatic pseudocysts are treated endoscopically by placing double-pigtail plastic stents across the GI tract into the cyst cavity. Although this approach has got over 90% success rate, it could be cumbersome and at times challenging since it involves multiple steps such as puncturing the cyst, placing guide wires, exchanging equipment, including sometimes exchanging endoscopes, dilating the fistulous tract, and placing multiple plastic stents. The procedure time is prolonged and it requires fluoroscopy. On the other hand, lumen-apposing metal stents can be easily deployed as a single-step procedure with endoscopic ultrasound guidance, and the time of the procedure is extremely shorter as compared to the traditional multiple-step procedures of double-pigtail plastic stents. Moreover, we may not even require fluoroscopy for placing lumen-apposing metal stents. These stents are larger in diameter, and hence a scope can be advanced through these lumen-apposing metal stents into the cavity, and therefore they are primarily used for treating patients with walled-off pancreatic necrosis, where after entering the cavity, we can remove the necrotic material. Although entering the cavity is not required for draining pancreatic pseudocyst, the mere fact that these stents are so easy to deploy makes it tempting to use them also to drain pancreatic pseudocysts. Hence, in our center, we started using lumen-apposing metal stents for draining pancreatic cysts also. In the first 23 patients where we consecutively deployed lumen-apposing metal stents to drain pancreatic pseudocyst, we soon started realizing that within 30 days, around 17% of our patients started coming back with significant fever and chills, and were found to have infected pseudocyst. They required multiple reinterventions, and on endoscopy, we found besides having a lot of pus in the pseudocyst cavity, there were unchewed solid food material like tomato skins and onions lying inside the cyst cavity. So we hypothesized that a large, fixed, non-collapsible, almost 1.5 centimeter size in diameter fistulous opening that is created by these lumen-apposing metal stents can allow a two-way traffic, and therefore solid food can enter the cyst cavity and infect the cyst cavity. To address this issue, we decided to place coaxially a 10 French double-pigtail plastic stent through the lumen-apposing metal stent at the index procedure. Although this would not prevent liquid material from, say, the stomach entering into the cyst cavity from the side of the stent, however, it would definitely reduce the likelihood of solid materials from entering the cyst cavity. Using this approach, in the following 23 patients where we deployed the lumen-apposing metal stent and simultaneously placed double-pigtail plastic stents through the lumen-apposing stent, we found that none of these patients returned with any cyst cavity infection, and the cyst resolution rate was 100%. On the other hand, half of those 17% of patients who returned with cyst cavity infection with only LAMS, the lumen-apposing metal stent, without the double-pigtail plastic stents, half of them required surgery due to non-resolution of infection. So in summary, what we are suggesting or postulating that although lumen-apposing metal stents are very easy to deploy and they are ideal for walled-off pancreatic necrosis where we need to enter the cyst cavity to do necrosectomy, they may not be as ideal to use for draining pancreatic pseudocysts because of the two-way traffic that allows solid material to enter the pseudocyst and cause infection, high reintervention rate, and higher non-resolution rate. However, because of their ease of placement, if they are being used for draining pancreatic pseudocyst, we recommend simultaneously placing a double-pigtail plastic stent through the lumen-apposing metal stent to prevent or reduce the likelihood of solid material entering the pseudocyst cavity. Of course, in this pilot study, this initial observation that we found will have to be validated by subsequent large-scale prospective randomized study. Thank you.